It's a real honor to be here, and I wish to thank CODA 2021 for the invitation to participate. I will be presenting the update on hepatitis strategies, policies, and guidelines and implications for Africa. As a hepatologist in Africa, the mention of viral hepatitis brings to mind the clinical image of liver cirrhosis and ascites and bleeding, and of course, liver cancer. And therefore, I welcome the opportunity to make this presentation from a global health perspective that proposes the vision of elimination. In this short presentation, I will explore four main themes as shown in this outline with the background, and then we talk about the validation of hepatitis elimination and the Global Progress Report 2021 and its implications for Africa. And we finalize this discussion as we talk about the next steps on the road to the year 2030 and elimination. So the Global Health Sector Strategy 2016 to 2021 articulates the goal to eliminate viral hepatitis as a major public health threat by 2030 by adopting a public health approach. It provides a roadmap for elimination, and this elimination is defined as a 90% reduction in incidence and a 65% reduction in mortality to both hepatitis B and C by 2030, delivered through the scale-up of 5 key synergistic interventions across the spectrum of prevention, care, and treatment. And I know we're all very familiar with this. As shown in the slide, the areas are hepatitis B vaccination, hepatitis B PMTCT, blood safety, injection safety, harm reduction, testing, and treatment services. And this table shows the indicators, the 2015 baseline, and targets for 2020 and 2030. Now, these ambitious global targets guide the setting of national targets. Now, these strategy targets are aligned with the 2030 SDG Sustainable Development Goals and relevant World Health Assembly resolutions. I will also mention the important strategic directions that guide the responses in 5 domains, and these are information for focused action, including advocacy and national planning for viral hepatitis. The interventions I've mentioned above, those 5 interventions. The third is the service delivery to ensure equity, and this will be important as we go forward, and financing to sustain these programs and elimination. And the strategy recognized the need for innovation to accelerate elimination. Now, multiple WHO guidance and guidelines informed by data and research and innovation are available to support all aspects of the viral hepatitis elimination. The latest 2021 recommendations are for HCV self-testing and the interim guidance for country validation of viral hepatitis elimination, which I will talk to. This slide shows the interim guidance for validation of viral hepatitis, and it was developed for countries seeking validation of elimination, and it's aligned with the global hepatitis strategy. It defines the criteria for country validation for both hepatitis B and C and provides a pathway for WHO recognition of country effort and certification of elimination in individual countries. The table summarizes the elimination targets. In the first column, the hepatitis B impact and program targets in column 2 and 3, and the HCV impact and program targets in column 4 and 5. The impact targets are described in absolute terms and highlighted in the red box. The HBV incident target is captured by HBV EMTCT as the prevalence of hepatitis B surface antigen in children aged 5 years and below. The HCV annual incidence is also defined for both the general population and the key populations represented here by people who inject drugs in recognition of the different epidemiological context of hepatitis C infection. So this slide shows the country preparedness for validation of elimination and provides key insights from 28 priority countries. So a rapid review of these countries from across 6 WHO regions were undertaken by the Center for Disease Analysis in collaboration with WHO and US CDC. And this was done in preparation of the elimination guidance to explore what data is currently available from countries. Each of the 14 potential measures of viral hepatitis data shown across the top of the graph were scored using a traffic light scoring system, green, amber, red, and white, where there was no available data. So the most commonly available data were high quality HCV and HBV prevalence from 11 and 12 countries respectively. It is notable that of the 7 countries from sub-Saharan Africa, Nigeria and Uganda both had high-quality hepatitis B data from population-based sero-surveys conducted as part of the HIV Impact Assessment Study. Within the African continent, Egypt was the only country within the continent that had high-quality data points in different domains. Overall, the least commonly available data across the priority countries were HCV, HBV related death data, incidence data for both hepatitis C and B, and the attributable fraction of cirrhosis and HCC that related to viral hepatitis B and C. It is evident that lack of quality data is a potential hurdle to tracing the progress of hepatitis elimination and the implications for. So this slide shows the new hepatitis B and C infections and mortality and hepatitis B prevalence among children under the age of 5 years old. It's interesting to note that the hepatitis B burden for 2019 was 296 million, up 15% from the 2016 baseline, while the hepatitis C burden of 58 million is down 22% from 2016 baseline. It was also reported of 3 million new hepatitis B and C infections and 1.1 million deaths, again down from 1.3 million reported at baseline in 2016. It is, however, noted that there are wide confidence intervals in some of this data. I think one of the major achievements was achieving the 0.94 prevalence in children under the age of 5 years in 2019-2020, thus meeting the SDG goals and the global strategy goals for 2020. So the next 5 slides will highlight some selected key data. This slide shows the global hepatitis B burden and new infections by WHO region. The blue lines represent the burden and the amber lines represent new infections in graph 1 and new childhood infections in graph 2. And this has implications for Africa because it shows that most of the new infections and most of the infections in children occur in the Africa region to be addressed. This slide shows the viral hepatitis cascade by WHO region. Now, the momentum to address viral hepatitis is growing. Progress has been made in service delivery. In 2019, 21% of people living with hepatitis C has been diagnosed and know their status, and 9.4 million people chronically infected were cumulatively receiving treatment at the end of 2019. This is a 10-fold increase from the 1 million people receiving treatment at the end of 2015. For hepatitis B, only 10% of people living with hepatitis B have been diagnosed, and 6.6 million commenced on treatment. There remains major gaps in testing and treatment, more marked again in the Africa region. But the availability of effective hepatitis B treatment and the direct acting antiviral treatment to cure hepatitis C offers great potential for elimination. A collective effort is needed to address the testing and right. In 2020, WHO published an access report for hepatitis C infection. This slide highlights the progress achieved in 12 low and middle-income countries with diverse hepatitis C epidemics and national responses. 4 of these countries, namely China, Pakistan, India, and Egypt, account for 40% of all people living with hepatitis C worldwide. 5 key enablers for success were identified: the availability of simplified norms and standards, quality assured product options, including diagnostics and generic products, including with WHO pre-qualification or other stringent regulatory agent, and national registration. Also, the affordability in different country context. We're looking at the prices of drugs and diagnostics, the equity in access for all populations in need, and importantly, the efficiency in delivery, how they leverage opportunities for procurements, financing, and service delivery. Political commitment is central, no doubt, to providing this enabling environment and unlocking domestic and international financing, which has been very well demonstrated in Egypt. So in terms of possible next steps on the road to 2030 for the Afro region, pertinent actions identified in the 2021 Global Progress Report and implications for Africa are on this slide. One is to achieve elimination of hepatitis B transmission, recognizing that the need for hepatitis B birth dose and preventing mother-to-child transmission of hepatitis B is great. The second is to promote patient-centered care and integrated service delivery while leveraging systems of primary health care. This is particularly relevant in the wake of the COVID-19 pandemic, and there is an increasing evidence base to support this. Successful integrated programs require a multidisciplinary approach in contrast to the existing siloed approach, and would require significant political commitment and strengthening of the health systems. The third point is improving access to drugs and diagnostics and strengthening the existing health systems. The fourth and fifth points are related to strengthening community engagement and recognizing their important role in reaching elimination and in the context of primary health care. Finally, promoting national, regional, and international collaboration is important, and notable examples are that of the African Union and the Cairo Declaration for Hepatitis that was in 2020. The Organization of African First Ladies, the professional organizations, and civil societies are important potential collaborations as well. So in terms of next steps on the road to 2030 for WHO, important is the development of the global strategy beyond 2021, and that is the 2022 to 2030 strategy with development of new absolute targets for 2023. The country's support for developing and implementing focused national plans and supporting the capacity to monitor progress towards hepatitis elimination is important. Again, we continue the country pilots of the criteria for the validation and constantly develop and build on opportunities that have emerged from the COVID-19 response. In conclusion, we do have the strategy and the tools to make hepatitis elimination a reality by 2030. So, although significant progress has been made in the past 5 years, major gaps in treatment and care remain, and political commitment and collective effort is needed to reach elimination by 2030, and the ongoing COVID-19 responses provide key lessons and innovations. On this note, I say a huge thank you for your attention, and I'm happy to address any questions that you may have. Thank you.